Okay, to finish our morning, we're moving on to the panel session. So could I welcome the panel members up onto the stage? So we'll start at the left here. So we've got Rachael McGruer here, who's Deputy Director of the Adult Social Care Local Improvement and Transformation Division in Scottish Government. We've got Rachael Cackett, who's the Chief Executive Officer of Coalition of Care and Support Providers in Scotland, CCPS. We've got Jane Mackie, who's, I think it's retired, it says here retried, but retired Chief Social Worker and Chair of Social Work Scotland's SDS project. And we've got Shubhanna Hussain-Ahmed, Partnership Development Officer from the Coalition of Carers in Scotland. And we've got Tressa Burke, Chief Executive Officer of Glasgow Disability Alliance. So, welcome to the panel. We've got a number of questions that, again, we wrote out to you beforehand and solicited some questions. So we've got a number of questions that we're going to ask. And I think Rachael, Bex, you've got the first question for Rachael.
I'm going to stand away from you so I don't deafen you with the mic. So are you ready, Rachael?
It's like you're scared of me.
Yeah, no, really, I'm really scared of Rachael. Okay, so the theme of today's conference is a decade of learning. How is Scottish Government embracing the expertise developed by the independent support organisations and national delivery partners over the past 10 years and more to support the implementation of SDS?
Okay. I'm not very good at using a mic, so I hope everybody can hear me. Normally, I don't need to worry about a microphone. I'm loud enough. Thanks, first of all, for inviting me along. I'm really pleased to be here today on behalf of the Scottish Government, and it was great to be able to hear from the Minister at the beginning of the day as well. And it's been a great opportunity to meet some people in person for the first time, including Donald, which is great. Though Bex and I had the joy of meeting in Oban last summer, which was great as well. And I think I mentioned that as an example of actually, it's something that I feel very strongly about, and I know the Minister does, about getting out and about and talking to yourselves, who are the experts on how the system works. You use it yourself, or you help other people use it and access it. So we are exactly the people that we need to speak to. So as I said, I was chatting to Bex and some others in Oban last summer, and I was actually up in Stornoway earlier on this week as well, because it's something that I feel very passionate about getting out and about. There is a number of us from the Scottish Government here today, which hopefully some of you will know, some of my colleagues already, because we're keen to hear from your experiences as well. But don't worry, colleagues, I won't make you stand up and wave your hands to embarrass yourself. So there's a number of ways that I can be specific about the way that we're committed to that engagement with yourselves as experts. So there's the national collaboration, which I think has been referred to already today, meets monthly with those officials that I've mentioned. And there's some really good examples of where we've worked through the national collaboration to develop advice and guidance within the SDS space, such as the improvement plan last year, and then before that as well, the updated guidance. We're really keen to have ongoing engagement through that national collaboration, and it's a really helpful forum for us to use going forward as well. The Minister also touched upon the post-legislative scrutiny that the Parliament is currently going through, and I imagine that many of you have already contributed to that process. We have been watching and listening quite closely to that process and listening to the recommendations that are coming out of it. So we'd encourage you to continue to engage with Parliament through that as well. And that will be guiding some of our thinking. And I imagine the Minister will be invited to participate in a later stage of that process as well. So it's something that we're very interested in. And then also another area that I'm very mindful of, and I'm aware I'm sat beside Rachael here, who spends a lot of time talking to me about the National Care Service. But this is the first time we've met in person, apparently, which is amazing to think. So I think the National Care Service is another area that I'm heavily involved in, thinking about how the local level of support will work under that. I think it's a real opportunity for transformation at the local level, but I also know that we need to improve the system now ahead of that. We're very committed to it being a co-design approach to the National Care Service. If you're not already, I would encourage you to sign up to the Lived Experience Expert Panel or the Stakeholder Register as a way of contributing into that co-design process. I'm also aware that Rachael and others this morning were at the first meeting of the Expert Legislative Advisory Group. I need to remember what all these acronyms stand for, which is work that we're committed to over the coming weeks and months to work with experts in the field on how we further develop that NCS legislation that is going through Parliament as well. So those are just some of the examples of how we're really committed to working with you. And as I said, it's something that I'm personally very passionate about. Is last time I was here, I was with Tressa actually at the and I think it was a joy to see Tressa again actually, because we worked together on the design of disability benefits, and I think there's a lot to be learnt from the establishment of Social Security Scotland and how we can truly design it with the people of Scotland.
Thanks very much, Rachel, that's great. I'm not going to throw that one open to the rest of the panel because it's specifically aimed at Scottish Government, but what I'm going to, unless somebody's got a comment to make, but what I was going to say, the next question is from Anne-Marie Monaghan. Anne-Marie. We've got the microphone here. It's coming to you, Anne-Marie, but...
Rachel, CCPS is on record saying that SDS... Now I have to stop shouting. So CCPS is on record of saying that SDS has never been fully implemented. What difference has SDS made to support providers, and what needs to happen to close that implementation gap that we've talked about on a number of occasions this morning?
Thank you for the question, and for those of you who had the acronym CCPS, that I realise there are a lot of acronyms on screen this morning. So we're the Coalition of Care and Support Providers. I also have a cold, so I'm going to hold the microphone away from me just for my co-presenters. And just try and speak loudly. We represent 90 not-for-profit organisations providing care and support and assistance through Scotland. Many of them you'll know by name, and our job is to help make sure their voice is heard and to help make sure we translate what comes from Scottish Government to them. And it is true that when we responded to the parliamentary post-legislative inquiry that the other Rachael was just talking about, we have made the comment that we feel it hasn't ever been fully implemented. And there are a number of key issues that some of the providers who also have given evidence to that committee have made. One of them is the level of inconsistency across Scotland, which I think is really fundamental. There isn't a consistent approach. We have providers who work across many local authority areas and are finding, multiple versions of how this operates. And Rachael was mentioning the National Care Service, and it's an interesting one, isn't it? Because originally, with the original plans for the National Care Service, with local care boards under the direct control of the National Care Service, there was perhaps a sense that some of that inconsistency might be addressed. Now we haven't really seen the bill. It's all still to come in terms of amendments, and that was what this morning's meeting was about. I missed the Minister's speech in a meeting with government about amendments. But there is something really important about how can we get to a point where there's a real consistency across Scotland for how self-directed support is implemented and managed, how the culture around it is working. One of the areas within the bill, I think, that's going to be important is not only how does the new National Care Board and reformed integrated joint boards work together to increase that level of consistency, but also there's a lot of discussion around ethical commissioning and procurement and how that will be reflected in the legislation. Now, procurement, I think, is always an interesting word, because the moment you say procurement, you get into your head that you're into this space of technical competition law and legislative approaches. But actually, procurement, it's hard. It's about making sure money goes as frictionless as possible to the people who most need it to do the things that are required. And it doesn't have to involve all of the things that we end up talking about as an industry of procurement. And I'm interested to see how through a national care service, we can see increasingly that frictionless movement of money to people at the front line to make the choices that they need to live their best lives. And if the National Care Service can't do that, then we're missing something really important. And behind all of that is still a tendency within social care to think about how stuff is bought in very much a sort of tender process. It's about competition, it's about best value, it's about, frankly, too often pushing things to the bottom and getting things as cheaply as possible. And that's not what self-directed support should be, nor the culture it should engender. So I think we have an opportunity, now that there is this space to move, to be honest, fairly quickly from the sound of this morning's meeting, to look at how to strengthen the NCS bill, to think about how, and I understand the Minister made a commitment this morning around SDS and the National Care Service. How do we take the lessons? How do we take the learning from the implementation work that's happening at the moment, or the post-legislative scrutiny that the committee are taking forward, to really think, can we use the National Care Service bill to deal with some of the issues that, for providers, are really still in the way of this becoming a space of choice? And the final thing that I would just say there is the SDS bill has a whole section around sustainability. And the thing with choice is you only have choice if there's enough people out there to do the things that are required by people who are maybe taking their own budget. And we have an issue at the moment where the lack of investment in our sector is reducing that choice considerably. And if you live in a rural area, you're probably lucky to get any choice at all. And there is a question for us around, we can have aspirations, and I know we talk about implementation gap, but quite often in Scotland it feels like we have an aspiration chasm, not an implementation gap, that we say a lot of the right things and we try to do a lot of the right things. But if I'm honest, at the heart of it, particularly something that's about choice and control, if there isn't the value of the investment in this as a sector, as an area of investment in the people of Scotland, in communities, in our economy, in the ability for people to go out and live lives that they want to lead, then we are never really going to be able to implement SDS, because the choice won't be there. The relationship-based assistance and support that we've been talking about this morning won't be possible to deliver, because we'll be reliant on agency or people covering shifts. And actually at the heart of social care is relationship. So we have an opportunity with the work Rachel's doing in the NCS, alongside all of the other work around SDS, to think about how do we do this better, and how do we make sure that it is the heart of what we do, not the add-on at the end.
Thanks very much, Rachel. It's a consistent theme that's coming up this morning. There's a question online from Linda Riley, which I think you've kind of covered there. Is we've struggled to get local authorities to work in the same way, but it still doesn't happen. How can we stop this postcode lottery? Does anybody else from the panel want to come in on this? No? If not, I'll move on to the next question. But thanks very much, Rachel, for your response.
Can I just say something, because it was interesting.
Yeah.
As you tried to give me the microphone, I think it is the really knotty problem. And because of the way that we're now expecting the NCS to develop, I'm not sure we've got the answer to the knotty problem, because so much will still be held by local government, so much power, as far as we can see, will still be held by individual IJBs and local government, and we don't quite know what these strengthened IJBs are going to look like yet. It's not yet clear to me how the National Care Service will deal with unjustified variation. I don't really like the word postcode lottery, because I think actually the point of social care and support is to be very, very personal to people's needs. And actually there's something where it can be used, I think, as a bit of a sloppy shorthand to also try to make standardized what everybody supposedly requires from the centre. I actually think it's when we're talking about unjustified variation, and when that becomes implementation of a policy and the principles behind that policy, that to me becomes unjustified. And I guess my sense is we have to try to make sure that whatever comes next in the NCS bill through stage 2 helps us to deal with the fact that if councils are still going to hold the same power pretty much that they do now, how can we use that to get over it? And it's interesting that we're sort of all looking at each other, because I don't think any of us have really got the answer on how to do that, but we're going to have to think about it pretty quickly.
Yeah, that's great, Rachel, thanks. I think a related question really, Tressa, is you've been working with disabled people spanning now 3 full decades. So what insights and learning do you have about the barriers and blockages disabled people face getting to the social care that they need?
I think it's really building on what you're saying, Rachel, and I've thought a lot about this. I don't singularly have the answer, but I do think that there is evidence to show that disabled people are kind of cast aside, medicalised, categorised, blamed over all the history. There's abundant research and evidence, academic studies about this. Books have been written on the subject about how in every global crisis and every austerity measures, disabled people kind of being relegated to the bottom of society. Not that it should be a race to the bottom, but if it was, I think we'd fucking win it. But anyway, maybe not. There are others that are suffering. I think that's a bit of a cheap shot because it really shouldn't be a race to the bottom. So I know there are other groups who are really struggling, but I think there is a lack of understanding in the general public about what disabled people's plight is, what the barriers are, about the systemic failures and the structural inequalities. I think that there is a lack of, I mean, you were talking about aspiration chasm. I actually think there's a lack of aspiration. I think that in local authorities, there is an inevitability. People believe, the politicians genuinely believe they can't do anything. And if that's our starting point, that is not great. That is absolutely not great. So I think it's about not enough money is so obvious. It's such an obvious thing to say, and it is absolutely true. Local authorities need more money. But I think that in some local authorities, even with all the money in the world, they still might not make the best decisions for disabled people's social care. Verity House doesn't help with that because it's taken away the protective factor of ring fencing that we relied on as disabled people. So I think it's a combination of things, but I think that the kind of starting point of disabled people being disabilised, the way black and minority ethnic people are racialised, you know, we are experiencing barriers across the whole of our lives in ways across all policies and services. Things need to better join up. Resourcing is an issue, but motivation is a big, big part of that. And you always look, when you're looking at change, what is the motivation, what's the capacity, what's the opportunity? I think the NCS gives us an opportunity. I think there might be some capacity in it, but there's going to be resource issues in that as well. But fundamentally, I think motivation is a big, big problem we need to address, and I think that goes to the heart of everything.
Absolutely. Thanks very much, Tressa. I'm going to come to, there's a question for you, Shubhanna, from Kay Robertson. Kay.
Hi, Shubhanna. I just wanted, based on the current landscape and how challenging things are at the moment, wanted to understand a little bit more about how challenging it is for carers, unpaid carers, trying to access support for themselves through the self-directed support. Wondered if you could give us any insight into that. Thank you.
Thanks, Kay. Yeah, absolutely. I think there was a question just at the start asking about whether carers are entitled to self-directed support, and the answer is absolutely yes. So in terms of, I guess, some of the issues that carers are facing, I would say that is the first issue, that carers themselves don't realise that they are eligible for self-directed support, and that in itself is a barrier. But there's, as well as that, you know, we also then have barriers around, for example, when carers do know that they're eligible for self-directed support, they will then go through the process of requesting an adult care support plan. So we then end up with a whole series of issues there around requesting adult care support plans. That can take months. The completion of an adult care support plan can be another few months. Hearing back about the outcome of the adult care support plan is another few months. And then finding out whether you've got a budget or not is another few months. For a lot of carers, it's not uncommon for them to come to us and tell us that it was 18 months ago that they requested an adult care support plan and they're still waiting for a budget. Now, if you think about the fact that they have been eligible for a budget means that they have some quite critical unmet needs, and they are being left to just get on with it effectively for 18 months on their own. So there's a huge issue around, as I said, firstly not knowing, and then the huge time scales that it's taking carers to actually access that. But beyond that, we're also seeing the lucky few carers that actually get a budget, there are restrictions being put on what they can and cannot use, and it almost feels, I mean, we were here today thinking about, you know, reflecting on 10 years of self-directed support, and in my mind, I don't feel like we've learned any lessons that we've now applied to carers. It feels like as carers, we're going through the exact same scenarios where our spends are being scrutinised, and it's quite ridiculous spends. In fact, if you think about it, for a carer, if a carer says that the only way that I can physically get a break is if I was able to use a carer to come in for a few hours, because that would give me just a few hours where I can maybe put my feet up. And they're told, no, that's not a legitimate spend. That advice is wrong. It is a legitimate spend, absolutely. But the fact that carers are constantly coming up with creative ways and being shot down and saying, no, that's not a proper use of your budget. And the final area that we're finding carers are coming up against barriers is actually, so if a carer is requesting support and looks like they may be entitled to a self-directed support budget, the local authority will then say to them, hold on a minute, we just need to reassess the budget of your cared for person first, just to see whether some adjustments there might give you the support that you need. And whilst we're doing that, we're just going to pause any support for you, which is certainly not the right way of doing things. It feels like the spirit of the legislation is absolutely lost when people are trying to implement it for carers. I feel like I've painted quite a depressing picture, but that is the reality. I mean, in the sense of that, as an organisation, we are hearing more and more examples from carers of where, and what's difficult about this is carers are absolutely more and more aware of their rights. So we carried out a survey last year asking carers about their rights, etc. We find overwhelmingly that, you know, there's about 2/3 to 3/4 of carers who know everything about their rights and what they're entitled to, but when they're asking for those rights, they are not being respected. Those rights are not being realised. So we've got a huge gap there around those rights being implemented as well. I wish I had something more positive to say. I apologise.
Thanks, Shubhanna. And to add another to add to them, I think there's possibly another challenge that I'm thinking, going back to probably your question, Rachel, about how SDS has been implemented and the groups of people that access SDS can be a challenge for carers as well. I mean, I would remember, Jane, when we were in a meeting recently around addictions. SDS is for everybody who needs social care, but carers in that group didn't know that carers could access SDS for the people they were supporting. So we've got a challenge. We know that our biggest number of calls come from people who are supporting autistic people or people with dementia. And there's some of the biggest barriers there still to be implemented. Does anybody want to, Bex, do you want to come back?
Can I just come in? Just to put a little bit of a positive spin on what you were just saying there, Shubhanna, I'm really, really delighted to hear the number of carers who know their rights. And one of the things that we know through the disabled people's movement, through the independent living movement, is that when people come together, the power of the collective is massive. So there is something really important about all of us coming together and supporting each other in this mission to make sure that people's rights are upheld. If we're on our own, which very often carers are, you know, it's difficult to get out when you don't have the support that you need. It's difficult to know where to turn, but we need to all do our best to fill in those holes in that holy blanket that Donna talks about and bring that strength of numbers together.
Thanks, Bex.
All right, Shubhanna.
Okay, we'll move on. Lynn, I saw you coming in. Lynn's got a question that we're going to put to Jane Mackie.
Thanks, Donald. Jane, knowing what we know now, if we were back in 2014 for implementation, what would you do differently to make it smoother?
What would I do differently to make it smoother? I think really no systemic change of the size and magnitude that SDS should be in effect, is going to be trouble-free. I think there's always going to be, you know, some clunkiness on the way, and there's got to be, you know, and there's also got to be some trial and error to a degree. What should happen, I think, is that everyone should learn from other people's trials and the errors they make. I thought about this quite a bit, and I think there is no other way than just simply making this a corporate and strategic priority. I don't actually think that there's enough information out there. The standards, the plan, the everything. There's so much written about SDS. It certainly shouldn't be difficult. Isn't difficult necessarily to make this happen. There has to be the strong strategic and corporate will to make this happen. There has to be an understanding that we are talking about systemic change and not an add-on. I sort of perhaps trying to mix up some of my answers here for the other question that I may be asked. But I think there's something about the way we approached SDS which perhaps implied this was a pilot, it was incremental change. And the trouble with that over such an elongated period of time is that other things began to happen, and most notably, of course, the integration of health and social care happened. Now, if SDS, as I believe, is a massive cultural change, you're in the middle of that, and then overlaid onto that, you get another cultural change. And those cultural changes weren't necessarily compatible. So you have the tension that was inherent in trying to create the cultural change of SDS. And then you have, I think, both the departure of quite a few members of staff, the concentration going on to integration of health and social care. So there wasn't really even the people or the time or the energy left to continue the SDS journey, if you like. So that in many places it actually went backwards. And I would say that reasonably comfortably. In many places that is what's happened. So I think it is incredibly difficult to sustain strategic change over such an elongated period of time. So what I would say is time-limited, well-managed, tightly managed project plans that are corporately overseen, that are created with partners, with people with lived experience, carers, all organisations on board, monitoring this plan and being really clear what will be achieved at the end of each, let's say, annual, 1 year, 2 year, 3 year, however many years you agree that in your local area you are going to take to fully implement it. I think the other thing is, let's have an end in sight. So let there be, this is our goal and this is what it will look like. And I think one of the things that I've always believed is that many roles would change. There would be new roles created. People's roles would change. What are they? So let's try and describe our end point. Rather than it being just a little bit too intangible, let's try and make it a bit more tangible so that we have some idea of, are we actually getting there? Does it look like we're closer to that? Do we have to amend it? And can we talk with all our partners in actually, that vein? What needs to change and how should it change? So I think that would be, that would be what I say. Local authorities, I'm old enough to know when community care was brought in. Now, community care was a massive change. There was no, basically there was very limited, if no, adult social workers. That change was managed within, I don't know how many, it seems like it was managed within a couple of years. It really wasn't very long. And I think actually we've got to say it is possible, but it has to be that clear. With that objective in mind. There was absolutely no way anyone could avoid implementing community care when it came in. I think the problem is that we've kind of felt that this could grow. And I think maybe we have to look at our approach to implementation. And maybe that coincides with, hopefully, the alignment of the National Care Service and SDS. So that we've got aligned change as opposed to changes which have not been entirely perhaps complementary.
Thanks very much, Jane. Is it, something that having an end in sight was something we grappled with when we were working on the improvement plan, thinking Beth. We made our goal, the national, the implementation of the National Care Service. So, yeah, what will be the end goal? Did you want to come back on, Rachel?
Yeah, it was really a question, maybe for Jane as well, and I'm thinking about going back to when the bill was laid for SDS, and thinking also about the Integration Public Bodies Act as it now is, and the NCS bill as it's going through Parliament. And I wonder if you think, looking back, as much as we all would love to be collaborative and you know, get it done, do you think there could have been more in the bill for SDS around accountability and challenge that would have actually held people to account more clearly? And I ask the question because for two reasons. One is we've got a bill going through which is a framework bill, and actually if it's meant to have the sort of transformational culture change that we want it to, where is the focus for people who need care and support to challenge? And I also ask, because when the 2014 Public Bodies Act the bill was going through, I was involved in a lot of work around the principles, and you know, I chaired the group that wrote the guidance and helped with the drafting. And actually looking back, have they made the scrap of difference? Who's ever challenged a commissioning decision under integration by using the integration principles? I suspect nobody. So I guess two questions. Do you think it would have been better to have a bill that had more about accountability and challenge? And what could we do in the NCS bill that might help hold decisions that don't fall within the spirit of that legislation, hold people to account for that?
I think the short answer is probably yes. You know, I think so. I think that is, if I looked, you know, someone said, have I got some distance? Yes, there is tremendous pressures within health and social care. Financial, staffing pressures, COVID's coming. You know, there are so many pressures unless there is something which actually makes you act on this as a priority. Quite frankly, it's going to slip down. And it's as it slips down, you lose a focus and you lose traction and you lose momentum. And it's very difficult to pick up momentum again. You ask what exactly, it's very, I think that, you know, the governments are quite good at creating structures for accountability. And I would like to see, you know, some sort of, I suppose, fairly public and inclusive form of accountability, so that we've got to realise that this is a systemic change that can't just be done by social work and social care staff. It's got to be done by those that are in receipt of services, those that provide services, those that support the operation of this, which, you know, some of which have been very, very supportive. In my past authority, some of the finance staff were very supportive and very understanding, and include someone that was an auditor. However, procurement staff very often aren't, because, you know, they believe their legislation is more powerful than ours was. So I think there has to be something that is very, very corporate and collective and recognises that. But I think that would come from recognising what our end state is. Because while so many people believe that SDS is perhaps limited to, you know, which is very important, the good conversation that social worker will have with a carer or someone that is looking for support, it misses the fact that it's actually also about procurement, it's also about commissioning, it's also about the type of roles in an organisation. It's also about the expertise and skills that people will need and how they're going to deploy them. And it's fundamentally about changing a relationship between all of these parties. And I don't know if I would say that the hardest thing for anyone to do is actually try and fundamentally change relationships within organisations. Because it is so dependent on so many different things. And if I think back that, you know, I started actually trying to implement SDS in Murray, where I was at the time, before the legislation came in. So I was at it for well over 10 years and got to sort of a fairly good point, and did see things fall back as new people came, as we lost momentum, as there was diversion. So absolutely, let's create some sort of newfound inclusive, but accountability and with strength. And I know it's probably easier for me to say now I'm not in local authority, because people you know, find it difficult to have another body to be accountable to. But I think there's opportunities with the NCS, with local areas, because I think this should be locally based and very strongly focused on what is happening here, because that allows perhaps a stronger voice for some of these different stakeholders and partners to get in there. So no, I'm hopeful that actually we can reinvigorate a change process, but I wouldn't like to see it perhaps done in the same way as the previous 10 years, because I think that whilst I think it was admirable to try this, I think we have to perhaps have something stronger.
Thanks, Jane. I think Tressa would like to come in.
Thanks so much. Yeah, just thinking about thinking back to the Act and thinking back before that, a previous job, 30 years ago, my first job in social work, we were setting up some of the first independent living packages in Scotland, pre the Direct Payments Act. And when I think about what worked about that, it was that we had the money. So it seems like a really obvious thing to say, but 10 years ago when the Act came in, I would have reformed taxation. I would have progressive taxation that actually funds self-directed support, delivers the very well explained outcome intended, which was on the face of the bill, which was independent living, alongside the UNCRPD definition, independent living. And there is a lot of work being done on this subject of progressive taxation. It's not just a big ethereal thing up there. The Poverty and Inequality Commission have done work on it, the Accounts Commission, the government itself, tax specialists have done work on it. I know there's going to be a consultation about it soon that the Scottish Government are running out, so I think that may be part of the answer, because we are all struggling, and the big question is, where does the money come from for it all? So progressive taxation.
Thanks, Tressa. Rachael, you wanted to come back in?
Thanks. So unfortunately, tax is definitely way above my pay grade, Tressa. So so I can't promise that. But I think I just wanted to reflect that some of the principles I've been hearing from the conversation from the panel, and kind of maybe to help paint a positive picture of where the NCS is going, is those themes are very much ones that we want the NCS to address. So first of all, inconsistency is something we hear repeatedly, and that is something we have to address through national standards. I think for me, financial transparency, and I know that is something that the Minister is particularly exercised about, is really important. And I think the work that the Coalition of Carers did in looking at carer spending is a really powerful message to show that, and how we need greater financial transparency. Rachael talked about how money flows through the system, and that is one thing the National Care Service wants to make sure we have a better understanding of, that money goes to people to help them and to the services that they need and require, and that's really important. In terms of also, I think the inconsistency should be addressed through that greater level of national oversight. I'm sure Jane, as an ex-local authority person, is like, doesn't want another body to be accountable to, but I know the National Care Service won't necessarily be what people envisaged when the bill was introduced, but it is very radical to have ministers having that ability for national oversight in a way that they've never had before. So there's a lot of opportunities through the National Board. That is the intention, that they will be holding local government to account for the delivery of their services and the quality of their services in a way that has never been possible before. And when I go out and hear the stories of people's challenges, I find that really exciting, that there is a real opportunity for change. And I think also for me, it needs to be underpinned by that culture change that people have talked about. Social care is an investment in people, it's an investment in society, and we do need to change that. And I think one of my reflections I think we need to take away, actually, and to talk to colleagues in the Minister about, is actually the role that maybe government can play in further developing awareness of people's rights and entitlement. And I think we did quite a lot of that on social security, I think, Tressa, of changing that and benefit maximisation, and I think that that's really important, something that we get right. And then one other thing that I know the Minister is really passionate about, and I am, and I know the rest of the team are, is also we talk about making sure that people with lived experience like yourself and people who deliver are embedded within the National Care Service. We also want to make sure that they're empowered to be within that system, and they're supported, so they're treated on equal footing. So it's not just about saying they will be in the room. We want to make sure that they feel able to challenge, and I don't think that happens at the minute either. People may be in the room, but they're not listened to, and that is something we want to change in the National Care Service. So I suppose I want to say I feel there is hope within the National Care Service to address some of those themes. And it's a real opportunity for us, and to make sure that SDS is through the core and heart of the National Care Service as well.
Thanks. I think, Bex, if you want to come in and...
Yeah, I think that what you've just said there, Rachel, is music to my ears. One of the things that we need to tread a very fine line between the duties and responsibilities local authorities have, but we also need to open this out because SDS does not belong to local authorities. It belongs to disabled people and carers. So there's something really, really significant, once again, and I'll bang on about it endlessly, around that collaborative working, around treating every partner as an equal and important player, involving registered support providers as part of that mix as well, bearing in mind that most people access their social care through a registered support provider. So there's something really, really important about that level playing field that we need to work really hard to reach.
Okay, thanks very much, Bex. Lynn, does that answer your question? I think, you know, we could have a whole day.
Can you remember your question,
therapeutic
Lynn?
moan about what's no worked. But, you know, it's good to hear some of the things that might work in future. So thanks for asking that question, Lynn. It took up the time for all the other questions, so it was a good one. We are out of time now. We do have a load of more questions, so thanks for those that submitted questions. But I'd like to thank our panel very much for joining today.